Good morning, everyone. My name is Jim Kerrigan. Thank you for being here today as we host the Centers for Disease Control and Prevention's Tips for Former Smokers campaign. As a director of the Division of Tobacco Prevention for within the Department of Health and Human Resources, this event is an incredible opportunity to further our mission to prevent tobacco use and to promote cessation. It is an honor to have so many guests with our partners here, and especially our honored guests from the CDC. Your support in helping us achieve our mission is invaluable. I also thank Mayor Amy Schuller Goodwin, for allowing us to use this facility, the newly beautifully renovated facility. Mayor Goodwin is the first female mayor of Charleston. Before becoming mayor, she served as the Deputy Secretary of Commerce and Commissioner of Tourism for the state of West Virginia. During her career, she also served as Communications Director and Chief Spokesman for 2 governors, a presidential candidate, a congressman, and former mayor of Charleston, the late G. Kemp Melton. Mayor Goodwin graduated from West Virginia University with a degree in journalism and a minor in political science. Please join me in welcoming Mayor of Charleston, Amy Goodwin.
Every time I hear something like that, I always think, gosh, I hate it that my teenage boys aren't here to listen to all of that, because they just think that I'm annoying and not really funny right now at that stage in their life. Thank you so much. Thank you so much for allowing me to participate and to be here with you today. We have worked with the CDC, and I have personally worked with the CDC for decades, and it is my pleasure to stand here with you because I know of the good work that you do. I'm here to welcome everyone to the city of Charleston, but I want to make one mention, and I was talking to Allison Adler on my way up. In the city of Charleston, in the month of April, we launched, by the way, I've only been your mayor for about 4 months. Everything's going great. But in the month of April, we took every Saturday from about 10 to about 3 to do a citywide cleanup in every area of our city, because we know this: thriving communities, healthy communities, clean communities promote business, right, and movement of families. Over those 4 weeks, we collected close to 175 tons of trash. Think about that for a second. I personally walked in every street in every neighborhood, and you know what the number one thing was that we picked up? Cigarette butts. And you think it doesn't make a difference. Let me tell you, not only for your health, and we're going to hear about that today, but as a mayor of this capital city, I bring in investors every single day. We tour every area of this community. It makes a difference, every single one, not only for your health and well-being, but for this city and her thriving economic development. So thanks for allowing me to be with you here today. I'm so excited to listen to our guest speaker and enjoy the Coliseum and Convention Center and our great capital city. Thank you.
Thank you, Mayor. Now I want to introduce Ann Erling, Deputy Chief of Staff with the Governor, Jim Justice. Ann has more than 31 years' experience in community banking and was a senior vice president at Summit Community Bank since 1999. She earned her bachelor's degree from West Virginia University in 1986 and is a graduate of the Lloyd P. Calvert Graduate School of Banking. Ann is an active Rotarian, a Paul Harris Fellow, and serves as the Childhood Language Center Board. She's a former board member of the Ray of Hope, which helps women with drug and alcohol issues and to find sustained recovery. Thank you, Ann, for your dedication to the state of West Virginia and for being here today.
Thank you all. Good morning. I appreciate you letting me come here to speak with you today. Governor Justice sends his greetings as well as this proclamation from Governor Jim Justice. Whereas tobacco use remains the leading cause of preventable death and disease in the United States, killing more than 480,000 Americans each year. And whereas in West Virginia alone, 4,300 adults die from smoking-related illnesses each year. And whereas in West Virginia alone, The West Virginia Department of Health and Human Resources will host a media event on Thursday, May 16, 2019, at 10 a.m. at the Charleston Coliseum and Convention Center, featuring Amanda, a participant in the U.S. Centers for Disease Control and Prevention's CDC tips from Former Smokers Campaign. And whereas the CDC Tips from Former Smokers Campaign has effectively raised awareness about the dangers of smoking and has motivated more than 500,000 smokers to quit for good. And whereas we must work together to increase public awareness of the immediate health damage caused by smoking and exposure to secondhand smoke, to protect the health and well-being of our loved ones and neighbors. Now, therefore, be it resolved that I, Jim Justice, Governor of the great state of West Virginia, do hereby proclaim May 16, 2019, as CDC Tips from Former Smokers Day in the Mountain State, and urge all citizens to help encourage residents to stop smoking. In witness whereof, I hereunto set my hand and cause the great seal of the state of West Virginia to be affixed. Done at the Capitol, City of Charleston, State of West Virginia, this 26th day of April in the year of our Lord, 2019, and the 156th year of our state. Jim Justice, Governor. I'd like to formally present this to you. And thank you. I appreciate it. Yeah.
Thank you, Ann. Smoking is a real problem impacting too many families in West Virginia. Here to discuss what the state is doing to address smoking is Dr. Kathy Slemp, State Health Officer and Commissioner of DHHR's Bureau for Public Health. Dr. Slemp has dedicated her career to improving the health and well-being of West Virginians. In 1994, Dr. Slemp began working for DHHR in the Bureau of Public Health and is a founding director of what is now the Division of Infectious Disease Epidemiology, and subsequently directed the state's emergency preparedness efforts. Before returning to DHHR in 2018, Dr. Slemp served as a public health consultant for governmental, academic, professional, and community organizations, and as a relief and development coordinator for the Episcopal Diocese of West Virginia. Dr. Slemp holds a bachelor's degree in biochemistry from the University of Princeton and a master's degree in public health from Johns Hopkins School of Hygiene and Public Health, and an MD from Duke University School of Medicine. She is a published author and has served as numerous boards and boards for the CDC, U.S. Department of Health and Human Resources, U.S. Health and Human Services, and Association of State and Territorial Health Officers. Let's welcome Dr. Kathy Slemp.
Thank you, Jim. I wish Mom and Dad were here to hear all that. First, I want to say thank you to our federal partners from Centers for Disease Control and Prevention for coordinating this event today. It is wonderful to have you here. You have been longstanding partners. For our state partners here, the governor's office, the mayor's office, tobacco is an area that we really have to address together. It is a collaborative effort, and it is really with these folks and those of you in the audience and every West Virginian that makes a difference. I also want to say thank you to a fellow mom, Amanda, who has come to join us today, who speaks, I think, so passionately, so articulately, so honestly about the challenges of quitting smoking and the importance of doing that for ourselves and for our children and our future. So thank you for doing that. Tobacco use, as you heard earlier today, is the single most preventable cause of death and disease in the United States and here at home in West Virginia. West Virginia has a smoking rate that is about 26%. So over 1 in 4 adults in West Virginia smoke tobacco. So why you had all those cigarette butts that you were having to clean up every day. That rate is actually the highest rate in the nation. It is almost double the national rate of 14%. We lose 4,300 West Virginian adults to tobacco-related diseases every year. Those are our family members, our neighbors, our business workers, colleagues. They are critical West Virginians that we need to be keeping healthy and alive. And the issue extends to our youth. In 2017, 26.6%, again, over 1 in 4, high school youth reported currently using any tobacco product, including e-cigarettes, an enormous upsurge that we have seen in that. So this is a serious issue. The impact is devastating, and it's not just devastating on our public health, but on our economy. Annually in West Virginia, we spend $1 billion on healthcare costs associated with tobacco use alone, and another $1 billion in lost productivity. That far exceeds any tobacco revenue that we would ever see. So West Virginia in partnership is aggressively addressing the problem throughout West Virginia, in our communities, and across the state. The mission of the West Virginia Division of Tobacco Prevention is to reduce disease, disability, and death related to tobacco, but doing so will take all of us. We're working to educate users on the dangers of any form of tobacco and to provide successful ways to quit through the West Virginia Tobacco Quit Line. Quitting is possible. It is very doable, and we all need to make efforts to support our smokers in doing so. The West Virginia Quit Line for tobacco is actually one of the busiest quit lines per capita in the United States. In fact, the West Virginia Quit Line is free to all West Virginia residents over the age of 18. It does not cost you anything to use the Quit Line. It offers 4 proactive coaching calls and unlimited reactive calls. You can call and get support and connection if you're needing to think about how to quit or want to have support in doing so. Participants are eligible for 8 weeks of free nicotine replacement therapy, so there's access to the medications that can really help support quitting, as well as the counseling that can go along with that. Calls are confidential, and they're based on each caller's needs. So I truly urge anyone who would like to quit smoking, and it's never too late to start to quit. And if you've tried before and not have been able to quit, try again. It works when you keep trying and you keep working at it. So I really urge anyone who would like to quit smoking to call the West Virginia Tobacco Quit Line. It's at 1-800-QUIT-NOW or 800-784-8669. Quitting smoking has immediate as well as long-term benefits for you and for your loved ones. It results in healthier babies, healthier adults, healthier workforces, and healthier communities. And our next speaker knows this. First using tobacco as a teen, she later smoked during pregnancy and had a premature baby. But she also very remarkably quit. And I'm so excited to have her here with us today. So next up, we have Amanda here to really tell her story to us. She is a champion for West CDC's Tips for Former Smokers campaign, and I'm just so excited to have you here with us today, Amanda. Thank you.
Well, thank you for inviting us here today, and it's been a privilege to share my story with everyone today. You have a beautiful state and a lovely city. I'm here to share my story in hopes that it inspires others, especially expecting mothers, to quit smoking or to never start. As it was said before, I smoked my first cigarette in 5th grade, and by the time I was 13, I was smoking every day. And by the time I was in high school, I was probably smoking close to a pack a day. I had very easy access to cigarettes. I started skipping class to smoke, and that's when I knew I was really addicted to nicotine. I smoked when I was young because it really did seem like the cool thing to do. My friends did it. Almost everyone in my family was a tobacco user. I knew a lot of people who smoked. And as I got older, it definitely became a way for me to deal with stress. When I was working my way through college and feeling the pressures of just juggling everything, work, school, all of that, I would definitely turn to cigarettes to deal. I tried to quit smoking a number of times, especially during my pregnancy. I remember throwing out packs of cigarettes and, promising myself I wasn't going to smoke again. And, by the end of the day, or definitely by the next day, I had another pack. When I became pregnant, when I was in college, I was still smoking. And I knew it was bad. I knew smoking during pregnancy was not a healthy choice. But I really didn't think anything bad was going to happen to me or my baby. I knew a lot of people who smoked while they were pregnant, and I thought it was fine. But something bad did happen to me and my baby, and that doesn't have to be the story for anyone else that's currently using tobacco while they're pregnant. My daughter was born 2 months early, and she only weighed 3 pounds. She had to be fed with a tube. She lived in an incubator. I wasn't able to hold her. I wasn't even allowed to touch her for the first week. It is very scary to be in a hospital like that with your newborn. Before her first birthday, she had developed allergies and asthma, and I know that that's because I smoked. She still struggles with asthma and allergies to this day, and she's 12 years old. For most of my life, smoking was an escape from stress, but in reality, it actually caused a lot of stress and anxiety for my entire family. My dad is a former smoker, and he's living with stage 4 lung cancer because of his smoking. I lost a grandfather to lung cancer, and then, I hurt my baby because I smoked. I'm sharing my story to save other moms the guilt and the pain that I felt because of my choice to smoke while I was pregnant. And I want more families to be able to feel joy and happiness after they have a baby and not be living in a NICU for a month. My family's a real example of how harmful smoking can be, and I'm just really grateful to have the opportunity to be here and share my story so maybe other moms won't have to walk through this. I quit, and you can too. Just thanks for having us here today.
Thank you, Amanda. Thank you all for coming to this important event today. We will now have an availability for individual media interviews. Please see Allison Alder, and she'll coordinate all those interviews. She's over here. Thank you all for coming.